The Ministry of Health published a document very quietly on a Friday night when probably everybody had checked out for the weekend. Perhaps they hoped that nobody would see it, but we did. And then it got withdrawn. And a lot of you were very interested to know why that was and what replaced it. Let's check it out. So this is a document that has been put out by the Ministry of Health, and it's an important one because it basically talks about the right for all people, both vaccinated and unvaccinated, to continue to receive medical care and to be able to go to hospital and be able to go to medical centres. And so let's take a look at just what it says. It's called the Position Statement on Pre-Consultation Testing of Unvaccinated Individuals in a Health Setting. And it makes some interesting statements, good statements. Access to healthcare is a fundamental right, and that an individual seeking healthcare cannot be refused care because of their beliefs. In this case, an individual who believes that a vaccine is harmful cannot be refused care for that belief. Routine testing of asymptomatic individuals prior to consultation would identify some infectious individuals and decrease the risk of transmission. So there's that first mention of testing. The difference in the risk of transmission between vaccinated and unvaccinated people will be negligible. Interesting. When there is high COVID-19 vaccine coverage, i.e. above 80% of eligible people are fully vaccinated, as in New Zealand, in most areas, transmission is more likely to occur from a vaccinated than an unvaccinated individual. There's an interesting statement. Testing of individuals for COVID-19 can provide a high degree of reassurance that an individual does not have an active infection. Testing may also provide additional benefit to the individual and their contacts through earlier diagnosis of disease. Rapid antigen tests are less sensitive than PCR tests, but have been shown to accurately identify most infectious individuals. So you can see why we were very interested in that particular document, because it acknowledged, well, firstly, the rights of both vaccinated and unvaccinated people to continue to receive healthcare. There was some concern around that. But also it highlighted the importance of testing, because it gives the most current up-to-date status of a person who may be infectious, who may be carrying the COVID-19, whether they're vaccinated or not. So there was a bit of a flurry of our activity and correspondence around some of the statements made on that document, which seemed to go against some of the narrative that we have been seeing in the media. And the media picked it up eventually, about 5 days later. The New Zealand Herald talks about the fact that doctors have a duty of care to the unvaccinated. So that was a good result. But then in the New Zealand Doctor, the College of GPs talked about the fact that the position statement on care for unvaxxed was causing confusion. And what was the confusion? Well, they said that there are statements, this is the head of the College of GPs, there are statements in there that I think go contrary to the COVID-19 vaccine mandate, basically. So apparently the statements in this Ministry of Health document go contrary to the vaccine mandate. That raises some issues. Look, I'm not an immunologist. I'm not a medical professional. I just want the best advice for my family and for the community. And if it has to fit within this mandate, then are we moving away from the science? So let's look a little bit further. If you now go to the website, you will find that, whoops, that document has actually disappeared. And a new one has been released, an updated version 2. And so let's just have a quick check about what it says. It says that vaccination offers the best protection against COVID-19 for individuals, for those they interact with, including healthcare workers and other patients. However, some New Zealanders do not qualify for vaccination and some have chosen not to be vaccinated. It is important there is a consistent and scientifically logical approach to pre-consultation testing. Denying access to healthcare on the basis of vaccination status is unacceptable. Great statement. Vaccination status is one of many risk factors for infection and transmission. Unvaccinated patients who contract COVID-19 pose a high risk to themselves and to others. However, there is no evidence that the routine application of an approach incorporating pre-consultation testing is justified, which is kind of an interesting statement. Current evidence does not support classifying unvaccinated individuals as being in a group that should be routinely tested prior to a consultation, to the exclusion of others. Well, that's good. Everybody should be able to get medical care. But, part of the problem is that the second document excluded anything to do with testing. And yet there seems to be this acknowledgement that testing actually gives you the most up-to-date status of a patient coming in. I mean, that's my layman's understanding of what's going on. That vaccination, yes, does give you protection, but testing actually gives you the most up-to-date status. And in the latest New Zealand Doctor, so the revised statement on care for unvaxxed is an improvement. But there's some interesting statements in that article from New Zealand Doctor. It says, a new paragraph states that patients have a responsibility to follow health and safety guidelines when using a health service, such as wearing masks and social distancing, common sense. If a patient refuses to do so and care can be safely deferred, it may be reasonable to require a negative COVID test prior to a subsequent consultation following a risk assessment as to whether it is required. So if you've got someone who's unvaccinated and they're not taking basic precautionary steps of wearing a mask, for example, then they're saying actually a test would be a good assessment. But then in this New Zealand Doctor article, it finishes with this statement. We know that vaccinated people can still contract COVID and still spread COVID. However, what is apparent from the epidemiologists is that those who are not vaccinated have more chance of contracting COVID and more chance of spreading COVID. Yep, sure, that's the science as we understand it. But then this bit. The revised statement still cautions health workers that the risk of seeing a patient with asymptomatic infection is the more important issue rather than the vaccination status of the patient. As a layperson, that's my understanding as well, that actually it's the current status of the patient, which is probably more important when a person is entering, for example, a medical centre or a school or any public place, as to their current status above and beyond their vaccination status. Sure, the vaccination will help, but that rapid testing will be very important. That's why we have supported it. And that's what this document seems to be admitting. And it seems to be conflicting. Now, it's not the first time that the Ministry of Health seemed to have been all over the place. And you may actually remember when we raised the red flag about the fact that the Ministry of Health was telling parents that 12 to 15-year-olds could get their vaccination without parental permission. And then, of course, that was quietly changed by the Ministry of Health. And we were back to step one where parents were being notified. But of course, that's a live issue because we know that vaccinations may be happening in schools and it's vital that parents are part of that process. Look, the point I'm making here, as I say, I'm not an immunologist, but I'm just raising the issue that it seems like health advice that is coming out seems to be changing all the time. And it also seems to be being massaged around the current political push for vaccination rather than testing, which we also see as an option. And so the question I simply ask, it's a simple question. What is driving the Ministry of Health response and the advice that they're putting out? Is it the science or is it the political agenda? It's a simple question, but I think it really does need an answer.